coming up for 25 minutes to 10 o'clock on this Monday morning. Now, South Africa has more than 10,000 confirmed COVID-19 cases at the moment.
And over half of these cases are currently active, with almost 200 deaths now and over 4,000 recoveries.
Now, government has noted with concern that 84% of new cases come from the Eastern and the Western Cape.
Well, let's discuss all of this now with Dr. Juno Thomas from the National Institute for Communicable Diseases. Dr. Thomas, a very good morning to you. My partner and I here, Yvette and I, were discussing this earlier when we looked at the numbers, and we're wondering, why are we seeing this jump in the numbers currently? Is it because we're heading towards that eye of the storm that Dr. Mkhize, the health minister, has been warning about, or that more and more people are being tested?
Good morning to you. So I think in both cases you're correct. More cases or more patients are being tested. In fact, the new figures reflect the highest number of people being tested per day as yet. So there are increasing cases being identified due to the increased number of tests being conducted. But also it does reflect that we have now entrenched community transmission in many parts of the country. And as you've already mentioned, hotspots being Western Cape, Eastern Cape, but also Gauteng, KwaZulu-Natal have very concerning rises in the number of cases being reported.
Well, Dr. Thomas, would we also, how much of this would you attribute to our level 4 of a lockdown, that the easing of restrictions there? Would you say that that has played a big part, especially over the past week or so?
So I think we must be very cautious to interpret the day-by-day change in numbers of new cases. There's typically around a 2-week lag because of the incubation testing, because of laboratory testing practices, and because of the time it takes to get the results back. So generally what we're seeing now reflects what was happening in terms of transmission and testing around 2 weeks ago. So it's better to analyze the data on weekly trends, because that gives you a better idea of the overall trajectory. You must, as I said, be very careful of commenting on the number of cases from one day to the next. It's not an accurate representation for at least a week or two to see what the potential impact of the transition to level 4 lockdown has been.
Okay, but the level 4 lockdown started at the beginning of May, as we know, on the 1st of May, and then we saw that gradual easing. We are now sitting on the 11th. Is there anything we can read since the beginning of the month from what we are seeing currently, Dr. Thomas?
So I think one of the other issues one has to keep in mind is that there's been a lag in laboratory testing. So the numbers that we're reporting now are still from the end of April and perhaps even, the week before the end of April. So as I say, I think it's more prudent to wait for another week or two to see what the overall trend is, and for the labs to catch up on the backlog of tests that will give us a more accurate reading of what's happening in the country, and in terms of what the possible association with the transition from level 5 to level 4 lockdown may have been.
All right, doctors, also, I couldn't help but look at other provinces where the numbers look remarkably low. We're looking at provinces like Limpopo, Mpumalanga, the Northwest and the Northern Cape. I mean, figures like 28, 22, 23 or 16. We've got recoveries there. Also, if you look at their number of cases, just 54 infections, 61 in Mpumalanga, 45 in the Northwest, 29 in the Northern Cape. And bearing in mind what you just said about these results probably coming from the end of April, they are still relatively low compared to the rest of the country. Why do you think that is? Is it because fewer tests might be conducted there, or that just based on what the province's layout is, that we're seeing fewer infections there?
So I think there are a number of factors that can contribute to the low number of cases that are being identified there. And firstly, it may well be the testing practices. So it depends on who's being tested. Is it people that are presenting to healthcare facilities that have, symptoms of concern, or is it a lot of community screening and testing that's happening? And it depends on which communities are being targeted for screening and testing. That may impact on the yield in terms of finding community cases that otherwise wouldn't have been presenting to healthcare facilities. But it also may reflect the initial dynamics of transmission. If you recall, most of our initial cases were imported from travelers returning from Europe, and from there it seeded into communities and spread further. So it might be that these provinces were relatively spared because the initial cases weren't centered around those provinces, and community transmission didn't have as much of a chance to be established before the level 5 lockdown was put in place.
Okay, Dr. Thomas, as we conclude, and very briefly, it is encouraging to see we've got more than 4,100 recoveries. That should be sending a positive message to say you can and do recover from COVID-19.
Absolutely. So I think what people must still keep in mind is that the overall case fatality rate of COVID is low. And although the WHO released figures of 2 to 3% of case fatality rates amongst the countries that have been submitting complete data, it's probably much lower than that, because the number of cases that present with extremely mild disease, or in fact that have no symptoms whatsoever, is under-recognized. So the overall fatality rate is likely less than 2%. So most people will recover. In fact, only about 5% of people will develop critical, severe disease on average. So it is mostly a mild disease. Some will develop more severe disease that need hospitalization and oxygen supplementation. But there is still a risk for high-risk individuals that they develop severe disease, and unfortunately the risk of mortality associated with that.
Thank you very much, Dr. Juno Thomas from the National Institute for Communicable Diseases.